our show, Pulse by HealthJobHub. My name is Prashanthi Naidu, founder of healthjobhub.com. I started Pulse to connect with all you amazing people, share incredible stories, and to be inspired. My mission is to unveil the pulse behind the pulse. Today, I have a very special guest joining us live on Pulse. It is my honor and privilege to welcome Dr. Clifford Bierman, all the way from Boston, USA, to our show this morning. Good morning, Dr. Bierman. Thank you for joining us. How are you this morning?
Thank you, Prashanthi. I'm very well.
Oh, that's wonderful. Thank you for joining us. To all our viewers, Pulse by HealthJobHub is a live talk show. So if you have any questions, please ask. If you enjoy the show, please smash the like button and share with your network. I'd like to thank our sponsor, healthjobhub.com, for sponsoring our show. In response to COVID-19, healthjobhub.com has opened our platform to all employers during this time of need to post unlimited jobs. Dr. Clifford Bierman is an anesthesiologist in Boston, Massachusetts, USA. His passion for providing healthcare to the less fortunate has began as a U.S. Peace Corps volunteer in the early 1980s, and he has subsequently participated in 30+ surgical missions in low and middle income countries. Dr. Bierman has 35 years experience in medicine, dentistry, and public health, both nationally and internationally. Public and private sectors, academics, and private practice. He is proficient in pediatric anesthesia, regional anesthesia, airway management, patient safety simulation, and delivery of anesthesia and surgical care in limited resource environments. His commitment to patient safety includes instructorship status for the anesthesia simulator, whereby trainees are assessed, then educated in behavioral and communication skills during simulated operation room crisis. In addition to travel and exploring different countries, Dr. Bierman enjoys reading novels, swimming, hiking with the dogs, and lately gardening. Dr. Bierman received his BS from State University at New York at Albany, his DDS from New York University, his MD from the University of Connecticut, and his MPH from University of Massachusetts in Amherst. Wow, Dr. Bierman, this is an incredible bio. Thank you so much for being our special guest. Please share your story about what inspired you to pursue a career in dentistry, then go on to pursue a career in medicine, specialize in anesthesia, and become a humanitarian.
Well, so thank you very much for having me on your show. I'd like to say it's a beautiful day here in Boston. So I think what initially inspired me on this pathway were my parents and my sister, who were all very interested in education and the importance of education, training, and experience in becoming successful in life.
Mm-hmm. Yes.
Secondarily, I was inspired by some historical figures, and particularly President Kennedy,
Mm-hmm.
who created the United States Peace Corps, which
Yeah.
I heard about when I was a child and never got that out of my mind. And also President Lincoln, who I admire tremendously for his humanitarian efforts during the worst crisis this country ever faced.
Yes.
And combined with all of that, I was always very, very motivated to be the best that I could be and become all that I was capable of doing.
Well, that's wonderful. Thank you so much for sharing that. You have continued to regularly participate in surgical missions to low-income countries, Which countries have you been to on your volunteer missions? And what drives you to do the humanitarian work that you do?
So, having participated with many groups over the past 30 years, I have had the opportunity to travel to many different countries all over the world. That being said, I would like to make a distinction between volunteerism and voluntourism. Volunteerism is really the primary objective of
Mm-hmm.
why one would want to do a humanitarian project, to
Right.
help the people, no matter where it is that you are going.
Yes.
Voluntourism to me is a way of seeing the world through medical care. And
Mm-hmm.
even though that may help people, I really believe that the most important thing is to go to where your services are most needed.
Yes.
That being said, all the groups that I travel with that are itinerant do go back to the same locations on a regular basis for
Yes.
follow-up, which is extremely important, especially for, let's say, plastic surgery
Yes.
procedures, which may be staged and may need to be revised as time goes on.
Yes. No, that's wonderful. And tell me, please share your experience about your mission to South Africa with the Tshemba Foundation.
So the Tshemba Foundation is different from most of the other organizations that I work with. Most of the other organizations that I work with, you're part of a team,
Yes.
sometimes a very large team
Yes.
that encompasses surgeons, anesthesiologists, nurses, sometimes engineers, other types of people to help the mission proceed smoothly.
Mm-hmm.
And you travel as a group. Everything is planned for you, the transportation, meals, accommodations, etc. And those are typically very high volume trips where you may or may not be in accommodations that are either safe or suitable.
Right.
Tshemba
Right.
is different.
Mm-hmm.
With Tshemba, you arrange your own transportation to
Right.
South Africa,
Yes.
and you arrive at their location, which is on a private game reserve. You get there by yourself,
Yes.
and they provide accommodations for you while you work at Tinswalo Hospital, which is on your screen.
Yes.
Tinswalo Hospital is
Yes.
a very large rural public hospital serving approximately 300,000 people, most of whom are middle or low income. It is a very heavily trafficked hospital. Most of its work is in primary care and the treatment of tuberculosis, malaria, and HIV. There's a
Right.
heavy emphasis
Yes.
on obstetrics and on perinatal care as well.
I see. Yes. That is incredible. And how do you find volunteering with Tshemba different to any of the other organizations that you've volunteered with?
So with Tshemba, you are living in very nice accommodations, and they're
Mm-hmm.
very, very safe. South
Yes.
Africa does have a reputation in certain areas for being very dangerous in terms
Yes.
of crime, but
Yes.
this particular area is in a rural area near Kruger National Park, and it's actually quite safe. I
Yes.
think the only danger there would be from the animals, because there are no fences anymore.
Yes.
So all of the big five roam freely in that
Yes.
area. So you do need to keep an eye out, especially for the predators.
Absolutely.
Then the other aspect about Tinswala Tshemba Foundation is
Yes.
that you do work in the hospital during the day, and
Yes.
it is very, very typical of a very under-resourced, very busy, developing country hospital.
Absolutely.
However, at the end of the day, you return to the game reserve and this beautiful accommodation where you get to interact with the other volunteers as well as the staff.
Yes.
And in the evening, you can exchange stories, ideas, thoughts, and even network with the other members that are there.
Wow, that sounds incredible and definitely different to what is on offer with other volunteer organizations. And I'm sure each organization has something so meaningful and impactful to offer the doctor who's volunteering. So thank you for sharing that. In creating Pulse, one of our goals is to have our finger on the pulse. USA has been hardest hit with the outbreak of the global pandemic COVID-19, also known as coronavirus, Please share your experience during COVID-19 working in the USA.
So indeed, this has completely changed life and healthcare here in the United States. In my opinion, we were not well prepared for this.
Mm-hmm.
We acted slowly in response.
Yeah.
We do not have reliable resources yet, even for testing.
Yeah.
And in terms of treatment, we're still behind the 8 ball in terms of medical therapy or mechanical therapy.
Mm-hmm.
With that all in mind, we're now preparing the next phase, which is re-entry back into normalcy, which I think has to be done extraordinarily carefully.
Yes.
And I think before we even think about doing something like that, we need reliable testing to make sure that it's a safe environment to go back into.
100%, 100%. What is your medical advice for all of us who are staying home and waiting in anticipation for this lockdown to end?
Well, it would be my medical advice in general. So in terms of your physical health, you need to exercise, make sure you have the proper diet. In terms of your mental health, you need to keep your mind active, read, do puzzles, take courses online. This is a great time for people, especially people who may feel that their job may not be back when this thing gets better, to learn a new skill or learn a new language.
Yes.
In terms of spirituality, those who feel that that's important in their lives need to try to hold on to that in this era of isolation.
Yes.
And those who are non-spiritual should probably think about things like meditation to help with your well-being. This is also a true test financially for a lot of people.
Yes.
And it's time to relook at your budget and to rethink your long-term finances. And there's help out there, especially from the government, for those who need it. This is a great time to hook up with family, friends, and your pets, and to get together in that regard too.
Oh, that's wonderful advice. Thank you so much for sharing that with us. Thank you, Dr. Bierman, for enlightening us this morning and sharing your incredible story on Pulse by HealthJobHub. This brings us to a close of our Facebook Live show for Pulse by HealthJobHub. I do hope you enjoyed the show as much as I did. Please join me next week, same time on Facebook Live. I am excited to announce that our special guest joining us next week is Karshni Naidu, clinical psychologist, joining us all the way from Durban, South Africa, who will be sharing with you, our viewers, mental health tips to cope during this pandemic. Please join us again next week to be inspired. And don't forget, if you enjoyed our show, please smash the like button, subscribe to our YouTube channel, and share with your network. Thank you again, Dr. Bierman. It was an absolute pleasure having you all the way from Boston. Is there any final remarks you'd like to leave us with?
So those who know me would say, of course I do. So I would also like to put this all into perspective.
Yes.
For the past 2 months, all we've been talking about is coronavirus.
Yes.
But there's a big world out there. And for instance, last week, the number of people that died in the United States from coronavirus was still less than the number of people that died from cardiovascular disease and cancer. So let's not lose sight of those other issues from a public health perspective that are still extremely important. Cardiovascular disease, cancer, other infectious diseases around the planet, things like malaria, tuberculosis, HIV. Of course, my area of interest is the surgical burden of disease and taking care of that.
Yes.
And of course, always last on the list is mental health and budgeting and getting proper mental health treatment for the people all over the planet that need it. This coronavirus is going to significantly impact the social determinants of health, which will have an impact many, many years from now. Things like education, nutrition, clean water, security, housing. These are all things we need to pay very, very close attention to, besides just thinking about the eradication of this particular virus.
100%. That is absolutely wonderful, wonderful advice. And thank you so much for making your time available and sharing this great piece of information with us. Thank you for representing the Tshemba Foundation. I see Melanie, she's on our chat line, and she is so excited that you were able to share that experience of joining the Tshemba Foundation and volunteering. So thank you for that. I do appreciate that.
Thank you very, very much.
It's our pleasure. Have a wonderful rest of your day. And to our viewers, we'll see you again same time next week. God bless.